Hi, my name is Selena. I'm a student nurse, and I am here to ask you a couple questions in order to get a health assessment for you today, okay?
Okay.
Perfect. So before I begin, I just wanted to confirm your date of birth and your first and last name. Can I see your tag that you have here?
Vernon Hernandez, 21068.
Perfect. Thank you very much. And so the reason that we are doing this assessment is that you came in a couple days ago, and I was looking over the doctor's notes, and I just wanted to get a little bit more information to where we can go through maybe being able to put together a care plan for you to get you out of here, because I know you're anxious in order to go home.
Yep.
Okay. So Vern, or is it Vernon?
I go by Vern.
Perfect. Okay, thank you very much. And so besides what I've read in the doctor's chart, what brought you in exactly?
I had a stroke at home,
Okay,
and it resulted in my left side not working very well. I'm partially paralyzed at my left side. So yeah,
okay. And how long ago was that when you came in?
that was about a week ago.
Okay, and so you've been in the hospital ever since?
Yes.
Perfect. Not perfect, but okay. And were you rushed through ambulance, or did somebody take you? Or-
Yes, my daughter called the ambulance for me.
Okay, and then you came in that way. So did you feel it coming on, or?
I don't know. I was on my way to the bathroom and I had just fell, and I don't remember anything since.
Okay.
I woke up in the hospital.
Okay, do you have any pain now?
I just have some pain in my lower back and my legs, maybe because from when I fell,
Okay,
and my arm, my right arm.
do you bruise easy at all?
Pretty easy, yeah.
Okay, did you have any bruising on your?
I have bruising on my right side. Side I fell on.
Any on your head at all?
Not that I know of.
Okay. And how long has that been going on? Was it
The pain,
early on, or
the
not the bruising, I'm sorry, but the onset of the stroke?
the day of the stroke. How long has it been?
How long has did you have any symptoms before?
No, I was really tired and dizzy that day.
Okay, and it was just for that day?
Right.
Okay. And can you describe the last time that you really remember?
I did feel a sharp pain in my chest, and then everything just went black.
Okay, okay. And thank you for all of that. I do want to get to know a little bit more about you. And so what I'm going to do is just ask you a couple questions, and this is more or less just for a health assessment from everything about you in order to determine everything that we can do for you.
Sure.
Okay. So I know that you were admitted a few days ago. Did you come in on oxygen at all? Do you remember anything?
I have oxygen at home. I did come in on oxygen, I
Okay.
believe, in the ambulance.
Okay. And so have you been on oxygen since you've been here?
Yes.
Okay. And do you smoke at all?
I do.
Okay. And how many packs or cigarettes do you use a day?
About half a pack a day.
Okay. Have you tried quitting or trying to stop at all?
I tried, but when my wife died, I relapsed.
Okay. Okay. And so as far as the smoking, do you drink or do any type of recreational drugs at all?
I drink about a pack of beer a month.
Okay.
Yeah.
And just just because, or
Just because,
friends?
yeah.
Okay. Are there typical like other people around for friends or family? Or is it something just by yourself?
Just friends and family.
Okay. And do you ever drink alone?
Sometimes.
Okay. And why would you say you're drinking alone? Is it
Just to cope.
Okay,
Yeah.
for
My wife's loss.
and any drug use at all?
No.
Okay. And I am sorry to hear about your wife. How long were you guys married?
50 years.
Oh, I'm sorry to hear that. As far as your wife, are you taking or you're using any type of therapies or going any to recovery groups or anything to help you with any of this?
I just have my kids and my grandkids that keep me going.
Okay. And your kids and your grandkids, do they come over often?
Yes. Yes,
Do you live alone or do you
I
live?
do.
Okay.
Mhm.
And as far as getting around and driving, are you able to do that on your
I'm
own?
able to drive, yeah.
Okay.
Mhm.
And when was the last time? Where do you usually go whenever you're driving?
Just to the grocery store and back, and my daughter lives down the street, so I'll go to her sometimes as
Okay.
well.
Do you do any type of extracurricular or outdoor activities at all?
I like to play golf.
And do you feel like this would slow you down, or do you think you might be able to do some type of golfing since you do enjoy it?
I feel like it's gonna slow me down since my hemiplegia
Okay,
diagnosis.
okay. So they did go over the hemiplegia
Yes.
with you with the. And with the golfing, is it something that you could still possibly do, like a
I would
putting
like to,
green or
yeah.
something?
I would like to,
Okay.
I would like to find a way to get back to that,
Okay,
and get out of here.
perfect. And how often were you golfing?
About 4 to 5 times a week.
Okay, great. And when was your last physical?
I wanna say maybe like 2 years ago.
Okay,
Mhm.
and do you remember any of your results at that time?
They said I had high blood pressure, that
Okay.
was it.
And are you currently on any medications?
I'm on some high blood pressure medications.
Okay, and any allergies to any medications?
No.
Any allergies to any other foods or?
No.
Okay. And let's see. As far as any follow-ups, is there any other follow-ups that you should be doing besides this that your doctor recommended that you do?
No,
Okay. And do you take any over-the-counter meds at all, or?
just some Tylenol and ibuprofen and some melatonin to help me sleep.
Okay. And any hospitalizations or any other type of surgeries that you've ever had?
No.
Okay. And did the doctor ever discuss with you any type of surgeries that you possibly might need to have?
No, no.
Okay. And as far as family history, with any allergies or any diagnosis with any type of cancers or strokes
Just
or,
prostate cancer.
okay,
I had.
that your
That was
father, okay. And as far as getting around, do you live in a single story,
I live in a
Two-story?
single story home.
okay, so everything is, and you're able to walk and stuff. Are you able to walk on your own now, since you've been in the hospital, since they've been having you get up?
Been walking with physical therapy, so only with assistance so far.
Okay, and have they been able to see if you're able to get up on your own and use a cane or be able to use those things on your own yet? Or
Not yet,
okay,
only with
alright,
assistance.
perfect. And do you have anybody that could possibly come over and help you with those extra therapy as you're out?
My daughter.
Okay, and do they live close?
Yeah, just
Okay.
down the street.
Perfect, perfect. And would you ever consider any, I know that you haven't used any support groups in the past, but is that something that you might recommend? Is that something, if I was to recommend or a doctor was to recommend, is that something that you might partake in order to help with coping or?
Not something I'm interested in.
Okay, even with any type of age range or anything else?
No, I prefer family.
Okay, perfect. And as far as putting together a plan for you, how do you learn the best? Is it?
I mean, if you write out a list of instructions, I would be able to do it.
Okay, and is that something that you follow along with, or is that something that you?
That's the easiest for me.
Okay.
Yeah.
Perfect. And as far as a couple things I did want to ask with you being at home, did you cook a lot by yourself or?
I cook sometimes, I eat out most of the times. and
Okay,
My daughter brings over food.
okay. And let's see, are you able to drive now? Or is that something?
Yeah.
Okay,
Oh, you mean after my stroke?
yeah,
I don't think so.
okay. And okay, so at this point, what I'd like to do is I just want to compile all your information and see if maybe we can put together, I know that the doctor has a couple more tests for you and seeing if the physical therapy will start to help in order to gain back your left side, or some parts to that. So possibly we can get you back out there and golfing.
Okay.
But as far as now, it's something that maybe bringing you to and from your appointments or to physical therapy, you
Mhm.
think that your daughters can help you with that?
Yeah, for
Okay.
sure.
Okay, and additional food or anything like that, is that something that your daughters can also help you with since with
Yes.
driving? Okay, okay, perfect. Well, thank you very much for your time, and I'm gonna put together a list that would be able to see if that's something that we can go through together in order to help you at home as well, and then check up on you as well. That'd be okay?
Yeah.
Perfect.
Thank you.
All right, Vern, well, thank you very much for your time. I appreciate it.
Of course.
Okay,
Thank you.
do you have any questions for me?
No.
Not yet?
Nope, not yet.
Okay, all right, thank you very much.
You're welcome.